behavior therapy, parent behavior therapy, parent behavior training. In this video, I'm going to explain to you what those terms mean because they're really confusing to a lot of families. Hi, I'm Ryan. I'm a licensed clinical social worker who specializes in ADHD, father to a son with ADHD and learning differences, and a former school social worker. Let's start off by talking about the term behavior therapy. Well, behavior therapy is a rather vague term, and it can mean a bunch of different things. So number one, it could mean somebody who is trained in ABA. So that could be a BCBA, which means a board certified behavior analyst. Or it can mean somebody who has training in ABA, like a master's level person or a bachelor's level person, but is not a BCBA. Some people who are trained in ABA will refer to themselves as behavior therapists. Behavior therapy can also refer to a master's level clinician who has some training in behavior management. So as an example, when I was younger, I did some training in my home state of Pennsylvania to be a behavior therapist. And the training was a statewide training that they offer. And I will tell you the training was not any good, and I don't think it's improved too much since then. But typically what that position is, it's a mobile therapist who will come into a family's home and work with the family in the home. Last thing I want to mention. Anybody can refer to themselves as a behavior therapist or a behavior coach. That does not mean they are a licensed professional, nor does it necessarily mean that they have any formal training or education in a behavior-related field. Let's move on and talk about parent behavior training, or what's sometimes referred to as parent behavior therapy. And this is actually the American Academy of Pediatrics recommended treatment for kids with ADHD. If you'd like to see the evidence about this, you can go to the American Academy of Pediatrics website, or you can go to the website effectivechildtherapy.org and type in ADHD. So parent behavior training or parent behavior therapy are really interchangeable terms. And what that means is when parents get training in parenting strategies. Some of the more well-known evidence-based parent behavior training programs include parent-child interaction therapy, parent management training, and nurtured heart approach, which was one of the biggest influences on me. I decided I needed to create my own parent behavior training program because after I took courses in various parent behavior training programs, I realized that none of them really addressed executive functioning. And as we know, ADHD is an executive function developmental delay. So Scaffolding Better Behavior, the ADHD Dude Parent Behavior Training Program, is actually the first one specifically designed for parents of kids with ADHD. The two evidence-based parent behavior training methodologies that have been the greatest influence on me are nonviolent resistance, created by Dr. 𝗪𝗪𝗪, and, as I mentioned before, the nurtured heart approach, created by Howard Glasser. You may be wondering right now, why have I never heard this information before? Why didn't my pediatrician tell me about parent behavior training? Or why didn't the person who diagnosed my child with ADHD tell me about this? Well, here's a reason why. Most professionals, most educators, and even most pediatricians do not know the American Academy of Pediatrics treatment recommendations. So as a result, what they tend to do is refer families to talk therapy or play therapy, those kind of things, which are actually not evidence-based treatments for kids with ADHD. I want to be clear, I am not saying that a therapist cannot serve in a supportive role for a child or for a family. However, talk therapy or play therapy or even cognitive behavior therapy are not recommended treatments for children with ADHD. Cognitive behavior therapy has shown evidence to work for older teens and adults with ADHD. And what's really important with cognitive behavior therapy, if you have an older teen, is that they're motivated to participate. Because if they're not motivated to participate, it's not going to be a constructive use of time or money. The last thing I want to mention, it can be really difficult to find a parent behavior training program. What I have typically found is that sometimes they're offered through children's hospitals or through mental health agencies that tend to take medical assistance. And once in a while, a psychologist or a private mental health practitioner has training in one of the methodologies and they will offer it. Please check out Scaffolding Better Behavior, part of the ADHD Dude membership site, because at this time, it is the only parent behavior training program designed specifically for parents of kids with ADHD. I will speak to you soon. Take care.